It is now time for people to repent. This is not normal.
More than 1 million people die from malaria every year, with 90% occurring in Sub-Saharan Africa.
COVID-19 has changed our world.
Today we're planting 15,000 ebony trees in Cameroon, and for the first time, ebony won't be harvested from the middle of the pristine forest.
The scramble for Africa was over a long time ago, and now the continent is in your very hands. What you choose to do with that will define Africa's future.
Africa Science Focus is back. This is a weekly program from SciDev.net, where journalists from across the continent take you to the front lines of science in global development. This week, we take a closer look at abortion in Africa. We hear from women in Zambia and Malawi and examine the laws and the obstacles that they are facing. I am Selly Amutabi.
This current law now is killing people. It's killing women. It's killing girls because it's not safe. It's not accommodative.
Malawi's maternal mortality rate remains one of the highest in the world, with complications from unsafe abortion estimated to account for up to 18% of maternal deaths. With 16% of pregnancies resulting in termination, abortion presents a major health challenge. We speak with a woman who was unable to access a legal abortion and was instead forced to choose an unsafe alternative. This is Brenda. For safety reasons, her name and voice have been altered.
Right now, in as much as yes, abortion is there in the laws, but it is restrictive, it is not accommodative. In fact, we can say that abortion is illegal. Yes, it's there in the laws, like I've said, but it's restrictive in the sense that it only allows the woman to, or the doctors to terminate the pregnancy only when the mother's life is at stake. That's tricky because how do they define a mother's life being at stake or being in danger? Danger can be identified in so many ways. We can talk of the mental health, physically. So it's not everyone who is allowed to abort by the laws of Malawi.
A national debate has been underway in Malawi since 2015. Women's health advocates are attempting to liberalize abortion laws. Our reporter spoke to Dr. Chisale Mhango to understand the current legal framework and its intended purpose.
Abortion laws are there all over the world. The reason why there's an abortion law is to prevent women dying from complications of unsafe abortion. So when we find that women are still dying, are still procuring unsafe abortion, it means there is something wrong with our law. We need to revisit it so that it does what it is intended to do, that is to reduce mortality. What the statistics are telling us is that most abortions are not in women that have got a problem, a health problem. Okay? If they have a health problem, they go to the hospital, they get a safe abortion. But the ones that don't have a health problem, they are the ones who are refused safe abortion. And because they want to have an abortion, they have no alternative but to go to unsafe abortion. Unfortunately, most people we've been thinking that it was mostly young girls. But our studies show that 80% of the women that have been procuring abortion were actually married women. We have got too much work to manage women that have got secured unsafe abortion. They have to be with us for a longer time in the hospital. They have to go to theater, to cleaning, requiring surgical management and so on, when all this could have been done cheaply when a woman comes early in the morning, has his safe abortion done, afternoon they go home. We know from statistics globally that providing safe abortion, liberalizing a law does not increase the number of women coming for abortion. The number remains the same. You just shift from unsafe abortion to safe abortion at a reduced cost, a greatly reduced cost to the healthcare system.
The intended bill aims to expand the grounds for legal abortion to include threats to a woman's physical and mental health, pregnancy resulting from rape, and severe fetal malformations. Although some advocates hoped for more, Brenda says these first steps are important.
So you hear stories of people dying due to unsafe abortions. So I was lucky that I had access to go to the hospital, even though things did not go properly, but I had that access to go to the hospital. But we're talking of other people from the rural communities, from the rural areas, who don't even have easy access to healthy facilities. Even if they do, they can't even afford to pay because, like I said, it was a private hospital. So not
How much
everybody.
was it?
Around 20,000. Then, and that was some more than 5 years back.
And that's about $25.
Yes. So just simply because you're doing that, you don't want your parents to know, you don't want the community to know, you do it behind closed doors, you do it underground. You have no other choice but to try the other methods that people talk about. To say, okay, if you want to abort, you have to drink other herbs. Some say aloe vera. If you want to abort, then you just have to use a cassava stem. So people do that. People do that. They insert sharp objects in the vagina just to get rid of the pregnancy. So those are desperate measures, desperate methods, just simply because our government does not accommodate, or rather does not provide safe methods of abortion, which is through the hospital. Because now the fact that the law is not accommodative is becoming a challenge because we are losing people. Young people are dying every day due to unsafe abortions. Most young people are falling victims of defilement, even incest. Now, if for somebody who has been defiled or somebody who has been raped and gets pregnant out of that rape or out of that defilement, you can't force that person to keep the pregnancy just simply because the laws cannot allow that person to abort. No. There is so much trauma. They still have to live with the rape memories in their mind. And at the same time, we are making them to keep the baby. And that baby will be a constant reminder, an everyday reminder of that bad experience. So we're saying if the person chooses to keep the pregnancy, please, they should do it the safer way in order to save their lives. So this law is very important because it will protect our girls who are falling victims of rape, who are falling victims of defilement, including incest. Please, we need to have laws that accommodate people to abort safely. Because yes, the government chooses to give a blind eye to this issue, but the fact still remains that things are happening. People are dying all the time. And the funny thing is that the government doesn't permit or doesn't give easy access to safe abortion, but it treats post-abortion care. It treats the complications that arise from unsafe abortion. They will treat you. Yeah. So it's funny because the government is spending billions of money offering post-abortion care service, while it can spend less than that when providing safe methods of abortion, which is abortions conducted by well-trained, healthy personnel in the local hospitals so that they can be affordable for everyone.
Malawi's neighbour, Zambia, allows terminations of pregnancies on socio-economic grounds. Here is Timothy Banda from the Reproductive Health and Rights Organization, IPAS.
Abortions account for about 30% of the maternal deaths. As you may understand, abortions may be illegal or legal. There are safe ones which are done in a hospital by qualified medical practitioners, but there are also those which are done in the communities by the so-called quack doctors, or maybe the grandmother will give the girl the illicit drug, so to speak. So we have women and girls procuring drugs for abortion in over the counter, like in private clinics, in private pharmacies.
Even with clearer legislation, Zambia still faces an incredibly high maternal mortality rate. Few women who are in need of an abortion can meet the legal requirements that it be performed by a physician in a hospital with the consent of 3 medical practitioners. That there are less than 2 physicians per 10,000 people in Zambia is just one of the logistical barriers. We hear from Anna on her experience obtaining medication illegally from a private clinic.
I've done an abortion before. I got pregnant with this guy, and I never knew his parents or much about his family. And he said he was not ready, and he was not stable. And because he said he had another child with the other lady, the child which was 3 years, so he said I shouldn't keep the pregnancy. Also, to my family, I didn't want them to know about my pregnancy. And just the same boyfriend bought some tablets. I think that's the only thing that he invested money on. Yeah, bought those medicine, those 3 tablets. Yeah, they're the ones I used.
Okay.
Mm-hmm.
How did you use them?
I was told one was to insert. I started by inserting, and then the other one was to drink the same time after inserting the other one, and the third one was to be taken after 3 days.
Was it painful?
Yeah, it was, whereby you're forcing the period. It should pain, yeah. It pained a little bit, yeah.
Okay. Did you talk to anybody else about that?
No, it was a secret between me and the same boyfriend of mine.
Okay.
I never told anyone.
Okay, why? Why didn't you want people to know about it?
I was afraid of being stigmatized. People would say, no, she aborted and stuff. She's like this and stuff. People would stigmatize me, so I avoided that.
Anna touched on social stigma there, prevalent across the whole of Africa. Back to Timothy to explain what the sources of this stigma may be.
Stigma can be at individual level, because in Zambia, issues of abortions are taboo. Abortion is taken to be something somebody's not supposed to undertake. And this is critical because it's a barrier to accessing health services. Also at the facilities, the healthcare provider might stigmatize a girl, for example, who's young and they want to terminate a pregnancy, but also at community level. So where the community doesn't give such social support, where the healthcare provider doesn't give the necessary help to a woman who wants to terminate a pregnancy, then it becomes a critical issue.
That was Timothy Banda ending our report. Great statistics from Malawi and Zambia that depict various situations in most, if not all, African countries in the African continent that are trying to curb and fight high maternal mortality rate. And with abortion in the picture, just how safe can this be done? Got a question about today's episode? Drop us a message and we'll ask our specialist to respond. Contact us on WhatsApp via +254 799 042 513. You can subscribe to our program, download episodes, and leave a review at www.scidev.net. That is all for today on Africa Science Focus. See you next Wednesday. This program was funded by the European Journalism Centre through the European Development Journalism Grant Programme with support from the Bill and Melinda Gates Foundation.